everyone, and thank you for joining Extension and Engagement Week. If you're looking for the session entitled Frontline Healthcare Celebrating Nursing, you're in the right place. My name is Valerie Bader, and in addition to being a nurse, I'm an associate teaching professor in nursing. I also work in Extension and Engagement as a nurse specialist with a focus on continuing education for health professionals. I'm the moderator for this session. During the session, we will take questions through live chat. If we don't get to every question, we will answer your question individually afterwards. I'm joined today by 4 nurses, 3 of whom are deans in the UM system. This panel of nurses has extensive and a broad range of experience across many different nursing roles. To start the session, I want to briefly introduce each panelist and summarize their experience in nursing. First of all, I'm here in the studio with Professor Phillips, a nurse with expertise in public health. She has worked at the CDC and at the Missouri Department of Health and Senior Services as a nurse consultant on TB control. Currently, Professor Phillips teaches undergraduate and graduate students in the Department of Public Health, School of Health Professions, and she coordinates multiple projects designed to increase vaccination rates in rural Missouri. She is the board president of the Missouri Immunization Coalition and vice president of the Missouri Public Health Association. Professor Melissa Joy Roberts is both a nurse, practitioner, and an attorney. As a family nurse practitioner, she has worked with rural and underserved populations since 1991. Her clinical practice interests include family practice, dermatology, and mental health. Professor Roberts' law practice interests include wrongful convictions, healthcare policy, and legal issues in nursing practice. Currently, Professor Roberts serves as the interim dean of nursing and health professions at UMKC. Third, Dr. Sarah Thompson is the dean of the Sinclair School of Nursing here at University of Missouri, Columbia. Dr. Thompson has been in nursing academic administration for 15 years. Additionally, Dr. Thompson has taught at all levels of nursing education, including baccalaureate and graduate programs. Finally, her research focuses on improving the quality of care in long-term care settings with a special emphasis on end-of-life care. Lastly, Dr. Roxanne Vandermaus is a dean and professor at the University of Missouri St. Louis College of Nursing. She is both a registered nurse and the Donald L. Ross Endowed Chair for Advancing Nursing Practice. In this role, she partners with providers in the BJC Care Network and others in the St. Louis area. They educate nurses and plan for the future of nursing. In addition, Dr. Vandermaus studies how to improve access to health care, especially access to addiction treatment and mental health care. She uses qualitative, community-based research for her projects. I'd like to extend a warm welcome to all of our panelists and thank them for being here today. Each of our panelists has prepared notes about what nurses do, how nurses are educated, how COVID-19 has impacted nursing education, how the COVID-19 pandemic has worsened the nursing shortage, and finally, the role of nurses in public health. Let's begin by talking about the job of being a nurse. Dean Roberts, can I ask you to begin?
Yes. Hello to everybody, and thank you for inviting me to do one of my favorite things, which is talk about nursing and what nurses do. I do have some slides, if they can go up, if they can be advanced, but I'll move along here. If they can't be, there they are. If you can move forward one more. Okay, so what do registered nurses and advanced practice nurses do? Nursing is a field where everybody knows someone, a family member, a friend, a neighbor, who is a nurse or who was a nurse. And most people think they know what nurses do. But when you stop to think about it, most people have learned about nursing either from seeing their friend or family member coming home tired after a day's work or night's work as a nurse, or they've seen how nurses are portrayed on television. And I'm here to tell you, the way they're portrayed on television is not reality. The truth of the matter is, in real life, nurses do most of the things that they show physicians or medical students doing on those shows. It's the nurse who is with the patient for the entire shift, caring for the patient, evaluating the patient, recognizing signs of distress, supporting the patient when patients are scared, communicating with the family, advocating for the patient, working with the rest of the healthcare staff. The nurse is the one who is spending the most time continuously with the patients. And ultimately, the nurse is the person who is standing between an ill patient and the grave. And so that's why we need hardworking, educated nurses with a scientific background and an understanding of both the medical and the emotional and the communication responsibilities and needs of nursing. Next slide. Oh, you already advanced it. Thank you. RNs use their education in nursing and social sciences to continuously evaluate, educate, and care for people and protect people's lives and health. Go ahead and move forward one more. Okay. Nursing is also the largest healthcare profession. There are over 3.8 million registered nurses in the US. It's a lot of people. And yet we're usually out of the public eye, right? We're like the Cheshire Cat. We are invisible except for our smiles. Except recently, with the COVID pandemic, we've been front and center on television, in the news, and we've been recognized, and that's greatly appreciated by nurses. But the nurses have been working really, really, really hard for the last, what has it been, 18 months, 20 months of the pandemic. Approximately 500,000 of the nurses in the US are advanced practice nurses. Next slide, please. Okay. What do advanced practice nurses do and who are they? Advanced practice nurses are nurse practitioners, clinical nurse specialists, certified registered nurse anesthetists, and certified nurse midwives. And what they do involves treating and diagnosing illness, advising the public on health issues, managing chronic diseases, and giving continuous education to remain ahead of technological, methodological, and other developments in the field. The reason I have a picture of an infant there, a newborn, is because that's what advanced practice nurses do. They care for patients cradle to grave in the United States. Some may specialize. My specialty is family practice, so my patients have ranged from 24 hours old to 103 was my oldest patient, and he was living on his own in his own house, a short walk from my clinic. So I would go and make calls to his house. Next slide, please. Advanced practice registered nurses generally have either a master's degree or now even more commonly a doctoral degree, by the way. So they are very highly educated. Ultimately, we need more RNs, and the COVID pandemic, having brought nursing into the public eye, has also helped expose more of the fact that we have a shortage of nurses. We have a shortage of people going to nursing school. Well, we had a lot of kudos and Thanksgiving to the nurses who have worked tirelessly throughout the pandemic for their care. They've gotten really tired, and there weren't enough of them to start with when the pandemic started. So we need more nurses. We need more RNs. We need more advanced practice nurses. We need more diversity in nursing. We need more young people interested in the profession. The average age of a registered nurse is in their 40s in the United States. And well, 40s is younger than me. We would truly benefit from having greater interest in students coming even right out of high school into nursing programs so they can have long and prosperous careers as nurses. So if you know someone who's intelligent and personable and people-oriented, please say to them, you know, you're really smart and you're really nice and you're really hardworking. You should be a nurse. You should become a registered nurse. I think that is my last slide. If you could advance the slides. Yes, that is my last slide. So now I will pass the baton to Dean Sarah Thompson.
Thanks, Joy. We have some similar themes, which actually I'm glad, because they're very important and they have a real impact on the profession of nursing. First, I want to welcome everyone in the audience, and I'll be talking to you briefly about the nursing shortage. Next slide, please. 3 comments I would make about my presentation today is that the nursing shortage has been with us before COVID. It is worse now that we've been in and through COVID. And what can we do about the nursing shortage? So first, I'd like to share that some of the reasons for the nursing shortage prior to COVID. Well, currently in Missouri and in the United States, 1/3 of the workforce is over the age of 55. And the work that nurses do, as Joy was talking about, it's hard work in the hospital. It takes a toll physically on your body. Another reason is that individuals are living longer with more chronic illnesses where they have acute exacerbations when they'll end up in the hospital. All of this creates an impact on hospitals, more hospitalizations in general across the country. And then nurses leave nursing school with dreams that they're fulfilling their vision. However, many leave the profession within 3 years due to burnout, stress, and fatigue. Next slide, please. The American Nurses Association announced recently what we all know and have seen in the newspaper, that the nursing shortage is now a national crisis. COVID has left nurses feeling exhausted, battle-weary, helpless. And at the end of the first wave of the pandemic, nurses were incredibly hopeful. Now they've become angry. The second wave, the individuals that are dying, that they can't save their lives, are unvaccinated, and they are feeling angry and betrayed by the general public. In a recent survey, 66% of nurses, ICU nurses, consider leaving their jobs across the country. And health systems are reporting losing 80 to 150 registered nurses a month. Next slide, please. As Joy was sharing, so I'm glad that we are somewhat partners here. Nursing is a complex profession, and it requires a high degree of education. The individual that you see here is taking care of a patient with no less than 10 medications. The patient's on a ventilator and in a highly acute state. It requires a tremendous amount of education and experience to take care of a patient such as this. And nurses save lives. When hospitals lose nurses and they have a nursing shortage, more people die in the hospital. When there are fewer baccalaureate prepared nurses in the hospital, more patients die. Next slide, please. So let's watch a short video. Besides highly sophisticated, technologically enhanced care, what else do nurses provide?
During the COVID-19 pandemic, our healthcare workers haven't hesitated to step up. And in tonight's MVP, I'll introduce you to one nurse on the front lines who went above and beyond.
I wanted to make a difference.
That's why Courtney Henley says she decided to become a nurse. And it's what has kept her here during a global pandemic.
Seeing the difference that I've made in people's lives is like what keeps me going for sure.
It's a good thing she kept going.
I was afraid that I probably was going to die.
Because she kept him going.
And
kept him fighting.
I did have a great nurse with me.
Raul Castillo thought it was just a common cold at first.
One day I just woke up with mostly upper respiratory symptoms.
3 days later, he tested positive for COVID-19.
I knew that I was going down the hill.
He ended up inpatient at Columbia's University Hospital in June, and that's when he met
Courtney Henley. I have a special gratitude for her.
He had to get the breathing tube put in. He had to be chemically paralyzed.
But this wasn't her average patient.
Actually, I always wanted to be a doctor from my early years.
He works here too.
Having the doctor as my patient was definitely different.
I worked with those monitors every day, and it was very hard to hear that those monitors sounds were mine.
For a doctor used to saving lives, he was scared for his own.
And I told her that I'm going to die.
But Courtney kept him positive.
And the day that she told me, "You're not dying over here. You should stay at home. You wanted to die."
Talking to somebody who already had the knowledge and trying to keep them calm was very different, but rewarding at the same time.
She also kept his wife and kids calm.
Their family had so much trust in us, and we always prayed every time we got off of Zoom, and they told me thank you for everything we were doing.
Courtney kept fighting for this doctor, even taking extra shifts.
Trying to reassure him every day I was there that things were going to be okay.
And here I am.
After nearly a month in the hospital as a patient and weeks of physical therapy, Dr. Castillo is back to work.
I'm just so glad to see him back doing what he loves.
Beside a new friend.
Courtney was my guardian angel that was pulling me through it.
And now they'll keep up the fight together.
I don't have words to describe Courtney Henley. I just don't.
So thank you. I hope you got a feel for what the nurse did, and so much more than just the assessment and the technology. She gave her physician colleague who thought he was going to die the will to live. This is what nurses do. So again, let me just say this. What can we do to support nurses in the time of a nursing shortage? It's know who nurses are and what we do. There's a 99% chance when you walk in the doctor's office, it's not the one that takes your blood pressure or the one who gives you an injection. That's usually not the nurse. Or even in a veterinary clinic, I've had veterinary assistants come in and say, I'm your dog's nurse. No. Nurses are highly trained, and we actually save lives. A quote here from a physician that I know well says, "I am a highly skilled surgeon, but my patients will never leave the hospital without good nursing care." So what can you do? As Joy mentioned, appreciate what nurses do. Interestingly enough, this came out of NPR this very morning, and I'm going to read you just a few sentences. Nearly 2 years into the pandemic, there's some truth in a joke circulating among ICU nurses. They ask their hospitals for appropriate compensation for the hazards that they are experiencing, and the nurses are rewarded with a pizza party instead. Teresa Adams said that's exactly what happened at the Ohio hospital where she works. The facility across town was offering bonuses to keep its nurses from leaving, but not hers. They got a pizza party. And lastly, I want to say that we need to advocate. Advanced practice registered nurses provide highly sophisticated care. In the state of Iowa, when they relaxed regulations, more patients, Medicare and Medicaid patients, had access to care. Healthcare outcomes in the state of Iowa improved. So the last thing I want to summarize with is know who your nurses are, appreciate them, and advocate for change. I think our next speaker is Dr. Annie Vandermaus from UMSL.
Hi, thank you, Dean Thompson. That was excellent. Made me smile and reminded me, as I always know what nurses do, that we don't always talk about what nurses do. I read a meme the other day that said, a nurse knows more than she says and notices more than you think.
Yep.
And I think that's very true, and you set it up for us. This is a challenging time for nursing. It has been prior to and still is during this pandemic a challenging time. So I'm going to talk very briefly about the challenges and opportunities related specifically to nursing education. Next slide. Just a little notice here about the many different pathways to nursing. We don't always realize that there are, or maybe some of you do, that there are many different titles that nurses hold. And this is just a list generally. We have skilled practical nurses. We have the RN generalist who's really responsible for persons and groups across the lifespan, and then various degrees. We also have the Doctor of Nursing Practice degree that Dean Roberts spoke about as really the entry to advanced practice. And we have PhDs in nursing who are really responsible for the innovations in the discipline and fostering the next generation of nurses. So our schools here in Missouri, all three of our programs educate nurses at all these levels. Next slide. What we as educators need to think about is the accrediting process and the credentialing process. So we're educating nurses to do the tasks and the work of nursing that you've heard about, but we also have very rigorous and systematic processes that we follow. So there are a number of accrediting and credentialing organizations that start from our national bodies, and various schools respond to these credentialing groups. We also have specialty areas and then fellowships and particular recognitions. So you often see a number of initials behind a nurse's name, and that's when they move into specialty areas. And please ask them about that. We have nurses that do so many different things, but all are really educated to treat generally, or to understand the general needs of populations that they serve. We're, as educators, we're challenged now to produce excellent nurses, but then also to envision new ways to respond to the healthcare crises that we have at hand. And we're doing that right now at a time when, as you've heard, educators and nurse preceptors are down, our resources are restricted, and the critical events are up. Let's face it, this pandemic is a big one. We also have racial tensions and political conflicts, and we face poverty and chronic disease. We have an aging population. So nurses and healthcare professionals are facing some really unique challenges today. Next slide. As nurses, we have various guiding influences. Here are a few. We are guided by our national organization, the American Association for the Colleges of Nurses. They establish essentials for nursing education that we all follow. We follow very closely. We now have new guidance for curricula that we are all looking at currently, new essentials and domains for us to design our curricula around. And so we're in the middle of changing that now for the future. We respond to a code of ethics. This is what nurses have done for decades, centuries, I could say. And in our code of ethics, which is revised periodically, we respond to the traditional values of the nurse that include caring and authenticity and a number of other values. And we are looking at new directions for nurses to manage the new challenges of healthcare. So we are constantly juggling those issues that surround us. We also have just received the Future of Nursing Report 2020 to 2030, and it's titled Charting a Path to Achieve Health Equity. This health equity is something we've been talking about yet again for decades, and we now have an entire document that describes how we might be looking at ways to ensure that the population at large is receiving the health care that they deserve. And so we're integrating these ideas into our syllabi, into town hall meetings about nursing, we're creating fellowships and fellows in our organization so that we can follow the principles of health equity and guide our students in that direction. Next slide. The next slide is a couple of pictures of classrooms. And here I just simply want to say that nursing education, this slide kind of represents a turning, because nursing education is challenged to develop a new way of educating, and one that has been long discussed. That is that we are functioning, we are educating nurses within classrooms, bricks and mortar. We're also developing simulation labs. We're also educating nurses in the communities, both in hospitals and other community settings. And we're developing new ways of teaching that include hybrid forms of tele-educating and on-site educating. Some of that has been dictated by the pandemic, but some of that is simply good pedagogical practice, that we need to have various ways of educating nurses who have such a large job that has so many components to it. Next slide. Our clinical practice is beginning to look different because our healthcare system is looking different. Our hospitals, we're seeing shorter stays, higher acuity, busy preceptors, changing models, and we are learning that we need to educate nurses to respond to all of that, but also to be able to deliver care in the communities and in other kinds of settings. They need to be skilled in technology, but also in communication and various forms of interventions that are not setting specific. So we have learned that the gold standard for us is to provide students with real life experiences in clinical settings, and also provide simulation experiences so that they can view and critique and begin to think, establish their thinking so that they can respond to these many situations that they will face. And finally, last slide, I want to say that we are challenged with all of these many directions that we need to consider when we're educating nurses, and we are challenged because our resources are thin. But I do believe the future is bright for nursing. We're primed for new ideas. We're faced with these challenges that we need to work around. We need to move into together. We need to really brainstorm in new ways. So we have renewed curricula, broader settings. We're bringing interprofessional groups together. And the confluence of our opportunities and challenges is that these new ideas have come up in response to the needs of a changing society. We are right there with the people, as Dean Thompson and Dean Roberts have said. The nurses are with the people. We are there to serve, to improve healthcare for all, and we will continue to do that with the support of our communities. And that's all I have.
Next, please join us here in the studio while Professor Phillips talks about the future of nurses in public health.
Thank you, Dr. Bader, and thank you for the previous speakers and introducing the whole world of nursing to our extension world. We really appreciate that. And I'm going to talk about public health nursing today, and that there is a picture of Dr. Bader and I masked up and shielded up for a big day at a mass vaccination clinic this last spring. And gosh, it was just one of the most amazing days of my life. And I was able to give 96 vaccines in 4 hours. That's one vaccine every 2 or 3 minutes. And Dr. Bader gave about twice that because she was there all day. It's all about the footwear. So it was an amazing day, and there were so many grateful people there. And hats off to the Boone County Health Department public health nurses who organized that whole thing. We're there at 6 in the morning and stayed till 8 o'clock at night. And the logistics of it, where everything went incredibly smoothly. So public health nurses have been really active during this pandemic, but also they've been in our lives out there working hard in many different ways. So in a nutshell, let me tell you about sort of how public health nurses think. So imagine this river full of kids, and they're in distress, and they're drowning, and they need to be rescued. And we need nurses to do that. We need those nurses to rescue those kids, to take care of their respiratory systems, to take care of their infections, to take care of their mental health. That's all what nurses do. They respond, they step up, they triage, they do what needs to be done. But then there's public health nurses, and we need them too, because they go upstream, they figure out why those kids are falling in the river to begin with, and they prevent it from happening. So public health nurses are sometimes thought of as upstream thinkers. Put another way, consider illness as having 3 levels of prevention. So for instance, with COVID, primary prevention was trying to prevent COVID before you were even exposed. So we masked up and we social distanced, and that's primary prevention. Secondary prevention is preventing disease when it's asymptomatic, or post-exposure pre-disease, if you will, and we did a lot of screening. That was our COVID screening, mass screening events and everything. That's secondary prevention. And tertiary prevention is, gosh, you've got COVID, you're sick, you're in the hospital, and we're trying to minimize the bad outcomes from that. So our acute care nurses are in tertiary care, and frankly, that's where a lot of our funding and emphasis is in this country, is in that hospital care. But public health nurses live in the world of primary and secondary prevention. And our successes are, we celebrate actually what didn't happen. So we celebrate diseases that did not happen. And sometimes that takes a little bit of imagination, and I'll talk about that in a minute. But we're out there. Public health nurses are the backbone of our public health system in this country and in this state. They make up the majority of the public health workforce. A lot of people think public health nurses, give shots and do like education events, but really we're involved in a lot of activities, and you can see them there. Public health nurses do case investigations, contact tracing, and we do this for all kinds of diseases, and certainly we stepped up during the pandemic. We gave a lot of vaccines, we do that all the time, and we do a lot of health education. So I put this 1918 pandemic photo here to remember that public health nurses have been doing this for decades, and this is not our first rodeo, for sure. Public health nurses do a lot of education, and we can see here that the public health nurses make an influence on our ability to influence parents in their vaccination. Thank you. And in fact, some studies show that 8 out of 10 parents report that they change their mind about vaccinations when they are initially hesitant, based on the conversation that they have with their nurses. And this held true during the pandemic. This slide says that 8 out of 10 folks said that, if their doctors or nurses have a good conversation with them about their vaccines and kind of address their safety concerns and whether the vaccine works and so forth, they'll change their mind and they'll get a vaccine. So public health nurses have been really active in this field and doing a lot of education out there. And so I said, you gotta kind of have to use your imagination to celebrate what did not happen. So in Missouri, roughly half of our population is fully vaccinated. So what does that mean? That was a lot of public health nurse work right there. So I hope Julie Kapp is watching. Maybe she can check my math here, but I estimate that approximately 740,000 cases of COVID were prevented in Missouri thanks to these vaccination efforts. 23,000 hospitalizations were prevented. So, the previous speakers talked about how stressed out the nurses were in the hospital. So imagine if we had had 23,000 more hospitalizations and nearly 12,000 deaths prevented. So these are 12,000 souls that are still alive and enjoying life thanks to all of these giant vaccination efforts orchestrated by many public health nurses. This has not, again, been without a toll. The other speakers talked about the toll on nursing. Public health nurses, like our engagement folks, they were out embedded in rural Missouri, and they were frankly kind of caught in the crosshairs of things and some of the political divides that are rampant in our rural areas. They are understaffed. Our public health system has been neglected for quite some time, and so we went into the pandemic really with bare bones staff and abilities and capacity, and this was very stressful. So survey here, you can see about a third of our public health folks, including our nurses, are dealing with depression, anxiety, and PTSD, and tragically, nearly 1 in 10 has had suicidal ideations. And we've got to turn this around and support our public health nurses. I talked to one of my colleagues at the health department, and she talked about how she doesn't really get many days off at all. She really didn't get any for months at a time. And when she did get time off, she couldn't shut off her brain, and her mind was kept churning with all of the things going on at work. And that's a classic sign of compassion fatigue, and it's something that we're going to need to recognize in our workers. She loves her job. It's not burnout, it's compassion fatigue. Her body and mind and soul just could not shut off. And so as you're out there supporting public health, supporting our public health nurses, and you see a public health nurse, please give them a hug, because they've had a rough go. And that's at least the minimum we can do. The good news is, though, that public health has gotten a lot more attention and a lot more funding, and a realization that, gosh, we really, really need to support public health and build back our infrastructure that we've neglected for so many years. So we are hoping to get more support for public health nurse careers. We want to build a pipeline so that there's a genuine path for nurses in nursing school to move right into public health when they graduate. We need more programs for recruiting and retaining public health nurses, and just give them more visibility for all the work they do, because our public health nurses are really different kinds of heroes, and we need to celebrate that. So that's what I have for today. Thank you, Dr. Bader, for including this public health moment in our presentation today.
Wow, that was just terrific. Thanks to everyone so much for presenting this morning. We got to hear about how nurses are educated, what nurses do, the different kinds of nursing careers that are out there, that nurses are probably actually performing the kinds of things you think of physicians as doing when you watch television. And we also got to hear about public health nurses, one of the earliest types of nursing specialty practices where disease and illness are prevented by going upstream. So thank you to all of our panelists. I have been a nurse for a long time, and when I finished that public health mass vaccination clinic, the first thing I did was buy a new pair of boots because boy did my feet hurt. We're now willing to talk about take questions, and I have the first question is, what would be the most helpful support to frontline healthcare workers like nurses right now? This is an excellent question, and which of our panelists would like to take this? I take it it's not pizza parties. Is that what you take out of this, Dean Thompson?
Yeah, one of the reasons that I focused on knowing your nurse, appreciation, and advocacy is that we go through nursing shortages. We have a cycle of nursing shortage in this country, and this is probably the most severe one we have ever experienced. So short term in the crisis, I think it is appreciation. Long term, I think it is, really valuing your nurse and valuing what nurses bring and advocating to individuals that employ nurses. How do you value nurses? To your legislative representatives that create rules and regulations around what nurses do. Advocacy, I think, is what is going to happen long term.
Dr. Thompson, I could not agree more. And of course, advocacy looks like talking to people that you know in city government, state government, professional organizations about the potential for registered nurses and advanced practice nurses to really contribute to the health of our society and our state. And in order to do that more fully, of course, nurses in Missouri need to have our regulations updated so that we can practice to the full extent of our education and our license. There are nursing compact licenses for registered nurses that allows the same level of nursing care across the United States. And of course, that sort of movement is also happening for advanced practice registered nurses because we are educated to provide more care than we can provide in the state of Missouri. And so thank you for that. And so advocating for nurses would be your answer on how we could support nurses. I wonder, Dean Roberts, if you have a comment regarding how we might support nurses right now.
Dean Roberts had to go to clinical, but
So she literally
our
had to
other
support
dean
nurses.
colleague might have an answer to that.
Dr. Vandermaus, I wonder if you have an answer for that.
I really do believe that we are in a state right now where we're focusing on what we can do today. We're trying to plan for the future, and we're trying to involve our partners. And I think that all what everyone can do as a citizenry is, again, to appreciate the role and to recognize that and to place pressure on our healthcare partners and stakeholders to do their best to set up situations that are enticing and inviting for nurses. I think that we are in a state of change, and that we as educators and as practitioners are trying to work with a system of healthcare that it's a confluence of problems that has to be worked out. It's like a ball of yarn that has to be unrolled, and that we need some patience in that, but persistence in looking at where we're going. And that is to offer nurses opportunities that are that give them satisfaction in the role. So in education, we can do that by really holding firm to our commitments to educate nurses for the variety of issues that they'll face, but also to sort of plan for an even-tempered and leadership mentality moving into healthcare itself. So we're doing that in education. I don't know how we change the media. As Dean Roberts said, it's not like that. You know, Grey's Anatomy is not a good portrayal of the nurse, the nursing role. You know, I don't know how we do that. I think that these kinds of forums that you're providing here offer the public a way to understand what's needed in healthcare, so that they themselves can apply political pressure or you know, advocate for nurses broadly. I don't have the magic answer. I think we need to work together. That's clear.
Yeah.
And to work with our healthcare systems in any way that we can to elevate the position of nurses. This large healthcare body that really is often sort of hidden or taken for granted, you know, and until the need is there. And the need is here. You know, the draft is felt. We need to encourage nurses or people to go into the profession. Dean Roberts' appeal was strong, and you know, we support it. Dean Thompson and I support that too. Send you know, prospective nurses to the schools and support the schools. The educational programs will respond when given the resources. So I guess that's the best I can do with that very challenging question.
Thank you very much, Dr. Vandermaus. Linnell, Professor Phillips, would you like the opportunity to say how we might support nurses right now?
Yeah, well, you know, I live in the world of public health nurses, so supporting our public health infrastructure, and we need to really modernize our public health infrastructure in this state. I mean, our public health nurses are dealing with, you know, antiquated fax machines and outdated systems, and we really need a major modernization effort. And I think that the University of Missouri and Dr. Stewart and all his support of our efforts in extension are a really big part of that. And we really need to bolster our interdisciplinary efforts and build capacity in our rural areas so our public health nurses can really do their job and be supported.
Yes, and I'd like to weigh in on this question before I introduce the next session. I say free hiking boots for all public health nurses.
Yeah, definitely.
Thank you so much for participating in this conversation. Nursing offers a lot, and we have a long ways to go. But I agree with Dr. Vandermaus. We will get there, and I too am hopeful for the future.